The setting is the patient's house. And you are district nurse. The patient's doctor asked you to visit the patient's home and teach the self-insulin administration. You need to know the entire details of the patient as you are going to visit the patient at home. It's better to confirm the name with the interlocutor. Let's assume the patient's name is John. We can start a conversation. Hello, I'm Jessica, one of the registered nurses from the community health center. Is it Mr. John's house? Then interlocutor may respond to you like, yes, this is John's house. Then you can continue by saying, am I talking with Mr. John? He will respond to you, yes, I am. Then asked him, is it the right time to talk with you? Then the interlocutor will agree with that. Then we can tell him, your doctor requested me to visit you to teach you about self-insulin administration procedure. Is it okay with you? Then he may respond that, yes, nurse. I remember that the doctor has informed me that somebody will come here and teach me the insulin administration procedure. He wants me on insulin injections. Then we can ask him about his general health condition. Then he may respond to you, that I am okay. Why do you want me to take the insulin injection? Do you think that I have a high sugar level? Then reply him saying that I understand your anxiety. There is nothing to be worried about. Your sugar level is higher and it cannot be managed with your diet and the oral medication. So it's important to keep your sugar level normal. Otherwise, there may be some complication of diabetes such as kidney failure and liver damage. In order to avoid these complications, you need to take the insulin injection on a daily basis. Are you following me? Then he may ask you another question. I have been very scared of taking the injection since my childhood. Then respond him saying, I understand your worries, John. However, your sugar level is a bit higher and which cannot be managed by only tablets. So it is very necessary to take the insulin injection on a daily basis until it comes down to the normal level. Are you following me? Then he may agree with you and ask you like, are these insulin injections painful? Then, tell him like, never, they are not, they have got small needles and you do not need to inject them deep inside your skin, like other injections. I can show you how to take these. Then you can take the injection by yourself. Believe me, they are not going to hurt you. Then he may ask you, can you tell me where I can take the injection? Then respond to him by saying, you can take them on your thighs, stomach or arms. The best area for insulin self-administration is thighs. But you should always inject on the upper outer area of your thigh because taking injection on inner thigh will lead to many problems. If you choose stomach, always stay at least 2 inches away from the belly button. And if you choose arm, you should always inject into a fatty tissue on the upper arm. You need to take the right amount of insulin as prescribed and you can inject it. Then use a different area within the site. Insulin injected into the same area can cause lots of swelling or thickened skin. Also, remember, don't massage the injection site because it may interfere with the absorption. Then he may ask you, I understand the procedure, but I'm still worried. Then, reply him by saying, I really understand your anxiety. This injection is not going to hurt you. I'm also a diabetic patient and I was also scared of taking injections initially, but when I started taking it, I understood that there was nothing to be scared of taking the injection. Then the patient may agree with you. Then respond to him saying that, I'm glad to hear that, John. Do you have any more questions or concerns? He may respond to, nurse, I have nothing. Then we can educate him by saying, Mr. John, it is very important to dispose the needles after the insulin administration. for that you can collect all the needles in a container. When I visit you next time, I can dispose it properly. Is it fine? Yes, then offer him a leaflet. Here is a leaflet for you, which contains all the details regarding the insulin administration procedure. Then close the role play by saying, if you have any more concerns, you can contact me in this number, which is on the leaflet. I will be happy to assist you. Once again, I assure you that if you take the insulin administration properly, as advised by the doctor, definitely, you can bring down your sugar level and you can lead a healthy life. Thank you, Mr. John, for listening.